In honour of Women's Health Week, I would like to recognise a wonderful local organisation, Women's Health Tasmania. Mr President, Women's Health Tasmania is a health promotion charity run by women for everyone who identifies as a woman. Its vision, Healthy Tasmanian Women, and its values, respect, equity and solidarity, encapsulate the essence of Women's Health Tasmania. It aims to be Tasmania's key voice advancing women's health and well-being, where health is defined as a state of complete physical, mental and social well-being, not merely the absence of disease or infirmity. Women's Health Tasmania is overseen by a voluntary board made up of 11 elected women members and run by a team of dedicated health workers, activity providers, facilitators, administrators, childcare workers and volunteers, all led by CEO Jo Flanagan. To give you a sense of the scope of the services provided by Women's Health Tasmania, in 2019-20, Women's Health Tasmania had 8,812 occasions of service for women across 83% of Tasmania's local government areas. These services included over 4,000 class and activity attendances, over 1,200 online class attendances, 932 calls to the information line, 480 drop-in clients and 247 counselling appointments. Mr President, I think you will agree that Women's Health Tasmania has an extensive list of services and support that it provides for the Tasmanian community and Tasmanian women. It offers allied health services, including Bowen therapy, community nursing, continence services and hearing tests. They also have counselling and psychology and support services, along with complementary therapies like hypnotherapy. Women's Health Tasmania hosts a number of peer support groups, including breast cancer support, a sewing group, writers support and the fabulously named Waste to Wonderful, a textile sharing group for migrants and refugee women. Also included in the suite of services are health promotion classes, meditation, tai chi, yoga, mindfulness and specialised exercise programs, including the incredibly helpful Encore program, which is an 8-week post-surgery exercise program for women who've experienced breast cancer. Women's Health Tasmania also run workshops for all stages of womanhood, from stress management, which comes at any stage of womanhood, I might say, to baby and me and managing mother guilt, through to menopause and pelvic floor workshops. Mr President, like so many organisations, COVID-19 forced a major rethink of how Women's Health Tasmania would offer its services. COVID-19 hit women really hard and Women's Health Tasmania could see the impact anxiety, unemployment, poverty, family violence, visa crises and difficulties accessing help were having on its clients. Innovating madly, Women's Health Tas reached out to connect with people through online services, classes and forums. It recorded a brand new podcast series called She's Out There, covering varied and diverse aspects of sexual and reproductive health. It started a blog on topics ranging as diversely from why poker machines are particularly a problem for women, to cosmetic surgery on women's genitals and managing endometriosis. Quite a spread. Mr President, I love the ingenuity shown by this group in the early stages of this move to online and diverse delivery. Without proper cameras or tripods, they filmed classes using mobile phones taped to yoga blocks, taped to chairs, filmed in lounge rooms, bedrooms, kitchens, and that's when they remembered to press record on the machine. Teething problems aside, CEO Jo Flanagan reports that 6 months in, Women's Health Tasmania's online classes now rival the best that YouTube has to offer. In 2019, Women's Health Tas hit the road talking to women living in rural and remote areas of Tasmania and later also reaching out to women who identified as LGBTQ, particularly those living in rural communities. They discovered that although country women generally enjoy a strong sense of community and belonging, they also experience huge women-focused service gaps, poor internet access and digital literacy, and are hit by high cost barriers in accessing basics like healthy food services and transport to health care. Sadly, country women also spoke about their disillusionment with short-term funding and pilot programs that had begun in their areas but were not sustained. Women's Health Tas will continue their strong advocacy on those issues in pursuit of their mission, Healthy Tasmanian Women. Mr President, coincidentally, Women's Health Tasmania is holding its 2020 annual general meeting today. CEO Jo Flanagan kindly gave me an advanced copy of Women's Health Tas 2019-20 annual report. It's an engaging read about the resilience of women and their capacity to change direction when encountering the unexpected. I encourage you to take a look when it becomes publicly available in the AGM later today. I'm delighted to advise that Women's Health Tasmania is a semi-finalist for a Physical Activity Community Achievement Award. These awards encourage, acknowledge and reward those achievements that make Tasmania a better place. I offer my congratulations, Mr President, on the nomination of Women's Health Tasmania and wish the very best of luck to the whole inspiring team.
The Honourable Member for Windermere.